But then we're getting Dr. Hoa Wen, the Physicians Advisory Group chairman. We're going to go into news. Let's just take Dr. Shieh now, and then we'll go do news because he's going to surgery this morning. And he's out there walking, staying healthy. And it looks like he's wearing his N95 3000 mask. Good morning, Dr. Shieh.
Morning. How are you?
Where are you at? Good morning. I'm doing good.
I'm just right in front of my house behind SDA here. Actually, why am I wearing a mask? Because there's nobody out here, man. I mean, I'm by myself.
You
This
are,
is
yeah.
ridiculous.
Yeah, so there you
Yeah.
go.
Okay.
How's the weather out
Great,
there? Doc, how's the weather?
It's great. Today it's beautiful. I think we're heading into the dry season, maybe, but yeah, it's great.
My
I don't
first,
care what anybody says. Okay, take off your mask and breathe because, man, it is hard to breathe under a mask.
and you
How
got,
you guys doing?
we're doing good, Doc. I just wanted to first, thank you as an ally of the animals. I want to thank you for your donation to Guam Animals in Need. $1,000 donation. That was pretty cool.
Yeah, I donate to, we sponsor a kennel over at Gain over the last 2 decades, actually. Every year we donate, but I think, I had a booney dog, and I walked my booney dog on this park. This is a beautiful park here behind the SDA clinic. I used to jog with her here, and then I lost her to cancer just a couple of years ago. And then my cat lived till she was 22 years old. So, and I have another dog that's 16 years old that pees all over my living room. That's why I can't have any guests over. But it's all love. It's all love.
I didn't think you were a cat person.
Oh yeah, our cat's good.
It kind of changes things between us, Doc.
Cat keeps all the cockroaches away. Trust me.
Yeah, good point. Well, maybe American Bakery can get some cats. Oh! Ow! JK. Doc, so yeah, let's just start there because you had made this gain donation, but you also used it as an opportunity to call out the governor on her and Lieutenant Governor's re-election fundraiser, right? Which was this big $500 a plate affair.
Right.
So what was your issue with that fundraiser, Doc?
I thought it was the timing was inappropriate. I think right now there's still people who's suffering. There's people who's losing their mortgages, people who's maybe evicted. There's people who lost their businesses. This is not a time to ask people $500 for non-essential items such as re-election. You have another almost 2 years to run for re-election. So I think the timing is off. I don't mind if you want to raise money for your political agendas, but I think right now, especially when we're still in a public health emergency, right? I mean, the declaration is renewed, right? So I think that's inappropriate. I don't think that should have been done. But, it is what it is. I still haven't seen any pictures or videos of that event because I like to see it because I like to host an event as a charity event, but I can't see any videos because public health is denied us. GMA, our physician wants to gather and have continuing medical education. The majority of our physicians are all vaccinated, so I have no idea why they denied it. So I think we need to talk to them again. But certainly, I think the governor should share how that event was ran and show us some pictures and videos so we can follow it.
Yeah, I looked on. There's a lady, she's actually an auntie of mine, Kathy Flores. She works for the governor. But usually on her Facebook, whenever there's like a gathering or a function, I mean, of course, before the pandemic, she'd always post like a lot of pictures. So I checked her Facebook. I didn't see anything, but I think with the backlash that happened when they announced this fundraiser, I don't really foresee them posting a lot of pictures and videos. I do get your point, though, that you kind of want to see how they do it so the rest of us out here who want to have some type of gathering, because they're actually really creative, Dr. Shieh. I got to give them credit for that, that it was very creative the way they were able to entertain a significant amount of people over the limit for gatherings by having them in sessions where it was 23 people plus 2, that's Lou and Josh, and then it would be 25 people for 30 minutes, and they shimmy them out, then they bring in another 23, and then they bring them out. So you can't gather, like you can't have a gathering with like 200 people, but I guess as evidenced by what the administration did in this fundraiser, you can have a gathering of 200 people as long as it's phased in?
Well, here's the question: is that you have 25 people in the small room like Al Dente. I've held functions there before. What about staffing? Who's going to bring the drinks? You have to add those people in as well. How do you drink with a mask? You're going to have to take a mask off to talk. This is a cocktail social event.
Yeah.
People are going to have to roam around. I doubt it if they say, hey, you can only stand 6 feet away from me. Don't come closer to me. It's very difficult to manage those situations. So I think it's important that, that they show us how that's done. I mean, I like to see some videos, and I really do, because I think it's important for us to follow those guidelines. But again, it's very difficult to manage those situations. But I give my money to a good cause, and we'll continue to do charity work as long as I'm on Guam. I can't be on Guam forever. I'll be retiring. But I think it's important that we continue to focus on what the community needs are. Priorities are way off in this government, and I'm very disappointed on that.
Doc, let me ask you, because you're talking about charity work, and I know every year you do your scholarship.
Yes.
I mean, you usually have a big deal with, usually it's a gathering, and you have some type of thing where you announce it. So are you doing that this year? And then
absolutely.
Okay,
in fact, Chris, it's good that you brought that up, because
Thank you.
KUM was my first partner when we first kicked that off.
Right.
In fact, it was with Frank McCready, who was the host. And we kicked it off. Marie Calvo and I got together, and we actually kicked that off. In fact, I have to credit KUM for giving me that particular idea of a scholar athlete. I've always wanted to do it, and in honor of my grandmother. And we've done it every year. Last year we couldn't. We did a Zoom type of a thing, but this particular year is hard, because a scholar athlete, you have to add the athletic part of it. And the entire year there was no sports. So I've been thinking, and I talked to my family about it. And it's very difficult to judge these kids based on the junior year, because a lot of during your senior year, a lot of them actually excel. And it's very difficult. So all I got to go off of is based on the junior year achievements for the athletic abilities and achievements, etc., and the academics, of course. But this year, I don't know if we can actually do good judging for that, because I don't want to bring down the caliber or the quality of the awards. But I'm still thinking about it. And this is very important, because I also want to know how we can maybe have a banquet to honor these seniors, because I don't see why not. If you have a ballroom, okay, imagine this. You have a ballroom that's capacity of 500 people. And public health has said itself, you can go to a restaurant with 50% capacity, you can go to a bar with 50% capacity. Why can't you have a ballroom that you take up 500? Well, let's just take Dusitani, for example, 1,000. And you take only 20% of that ballroom, and you sit people 6 feet apart, use IBM tables rather than round tables. Why can't you do that? And rather than having a buffet, have people deliver bentos. You see a problem with that, Chris?
I'm pretty sure there's a way that you can figure it out while still adhering to all the guidances.
Well, let me tell you the truth here. And I always tell you the truth, okay? I submitted a letter to the Guam Public Health Director, Arson Augustine, and I said, we're going to take up Hyatt Regency, 500 capacity. We're only going to have 100 physicians, nurses, whoever's, in our association is come. Let me have capacity 100, which is 20% of the entire capacity of the entire 500 capacity ballroom. And we're going to use IBM tables, only 2 per table, everybody mask on with sanitizers. And you say, we're going to have bentos at the table, because you got to eat. Usually we do our scientific meetings, at about 6 to 7 to 8 o'clock. And they all, no, you can't. You cannot have food. I mean, I don't get it. Where's the science? Show me the science. And you say you cannot, because our safety protocol is much better than restaurants, much better than bars. And we're doing it as an educational event. And guess what? They turned us down.
Well, you know what I think you know what I think you can do, Doc, is if you do, because probably why they turned you down is they just saw that number 100 doctors. But if you split that ballroom in half, or you use like another ballroom, and then you have like 25 over here, 25, that's how you get around it. And that's what everybody is trying to do now, is we're trying to take these shortcuts and get around these different protocols, whether it's the governor and lieutenant governor, taking in 23 people at a time and then moving them out and bringing 23 more in. So that's how you do it, is you got to either have...
Well, Chris, trust me. Let me go a step further for you. our protocol that's set up is way safer than what the public health has instituted. Okay, they're like, I like the Felix Cabrera. He liked to steal lines, right? Oh, the CDC is the floor, not the ceiling. Well, Dr. Fauci said that in one particular incident. He likes to take those lines. It sounds great. Well, public health to me on Guam, if they want to be the floor, fine. We've gone to the ceiling. We even gone so far. Let me tell you this. Allow only vaccinated people to come into our conference. Those people who got vaccinated, come into our conference. That's even better, okay? Secondly, I say we're going to offer COVID testing right at the door. If you haven't gotten it, if you have symptoms, don't come. But if you want to get tested at the door, we'll do it. They still denied it. And doctors got to get continuing medical education, nurses as well. So we need to get back to face-to-face. Everything is online, great. But you can't beat a face-to-face interaction with speakers that qualified speakers from Cedars-Sinai, speakers, on island. So I really encourage public health to look at my protocol and give that a second consideration, because if not, Chris, we're going to host it right here.
Oh, there you go.
Park? We're going to host it right here. And
there's no limit on outdoor.
If you want to come here and arrest 100 doctors, you go right ahead, because we'll take you to court and we'll have the judge decide, and you show us the science where what our protocol is done is against CDC guidelines and it's against safety guidelines. We're not. We're doctors. And Cabrera's no smarter than me or anybody else. You know what I'm saying?
I feel you, Doc. Let me just, because I know you got surgery here, but I saw on your Instagram that you're having the very first evening clinic at the Shieh Medical Clinic, and you're calling it Friday Night Lights. Can you tell us a little bit about that?
Oh, yeah. I love football, right?
Yeah.
High school football usually is play on Fridays. And there's a show, Friday Night Lights. Great show. I love it. And we never had an evening clinic. We have several requests throughout the years that, hey, Dr. Shieh, we can't come to you because we're working as, working mom, working parents, or the dad's working that can't come to see the baby and an ultrasound. So we decided to try it out. And so tonight is the first night. We'll run the clinic maybe up to 8 o'clock to try it out, because I got to give my staff a break. But I think it'd be nice, because if you see my clinic, how it's built, at night it glows. It really glows. Chris, you should drive by and take a look. And we have a care garden outside. And I've instituted some LED lights that I bought from Hawaii. And it's going to light up. Every month, we're going to dedicate. In fact, I've got a request in April for Easter. There's a kid that actually passed away, and the mom emailed me and said, hey, Dr. Shieh, can you put up yellow? Now, yellow is not a primary color, so I'm going to have to be creative with that. And she wanted to dedicate that particular light because the son passed away and was wearing a shirt yellow. And that was very touching to me. So we're going to honor him, I believe it's April 4th, over the Easter week. So we're going to do that for him. And I think this is how we reach out to the community, is that we raise awareness. And the clinic will be here forever. I may not be here forever, Chris, because we at some point in time, we're going to be called to our graves and rest. But I'm still young, it's incredible to think about how many years I've been here. In August, Chris, hopefully we can have an open house at the clinic. You can come over, bring Sabrina, bring KUAM, because I think we've been partners over the last 20-something years in many events. Yeah. So hopefully at that time we can have an open house and you can see how a healthcare clinic is built the right way, and hopefully other clinic can follow through. And even if I'm retired in Hawaii, or God forbid that I get called to rest earlier than my life expectancy, but it'll be here forever, and hopefully somebody else will take it over and continue the standard of quality of healthcare that I've done over the last several years. So, but I'm staying healthy, so I'm not going anywhere very soon. Okay. Right
on. I know, because you're sounding kind of morbid, Doc. I'm worried. Are you all right?
I'm getting my heart rate up.
Right on. All right, Doc. Thanks for coming on. I've been trying to get you on for a little bit. Oh, before you go, I wanted to ask you, because there was a FOIA that I think Lee Weber and the Vigilance Committee had sent to the governor's office.
Yeah.
And this was a FOIA they sent, and they were trying to get any kind of correspondence between the office of the governor and the American Civil Liberties Union relative to that lawsuit that the ACLU just filed against the government of Guam, because we don't have any abortions or doctors who will perform abortions here on island. That being said, so the FOIA was complied with. They sent it out, and although I didn't see any communication in it from the Bureau of Women's Affairs or the governor's office to the ACLU, there was just a bunch of correspondence about abortions and securing an abortion performing physician for the island. And I know you had some interesting opinions on that, given that you were saying that we have other specialists that are needed here, right?
Absolutely. And I read Lee Weber, God bless him for getting that, because I think that people need to be transparent what they're doing behind the doors. It's very obvious to me that, Jane Flores from the governor's office, and, the governor has said it herself that she's really for abortion, and that's no secret. So I think what my comment is that just be transparent about it, but there is actually more special needs priority that we need on Guam. We need women's gynecologist that does cancer, for example. I can do precancerous surgeries, but if you get into extensive cancer, you got to go off island. And trust me, I just picked up 2 cancer cases that have been sent off island just 2 weeks ago. So they got to fly off island for their procedures. So if you don't have abortion on Guam, go off island. It's an elective procedure. It's okay. It's not something that's out of the ordinary. The interesting thing from those FOIA requests is that when I read, they're in direct communications with people at Family Planning in Hawaii. Dr. Kaneshiro, I know her very well. I give the patient the choice if they want. I don't do abortions. If they want to go, they go. But I don't judge them. But what I don't like is people hiding behind the backgrounds like, oh, well, we're not the one to ask for the lawsuit. Come on, Chris. Think. You don't think the governor enticed them to sue themselves? Of course they did. It doesn't take a rocket scientist to tell you that. That's the whole point. But if they want a abortion by mail, if they want to mail in pills, etc., by mail, if there's no law against it, we can't do much about it. But you got to remember that you should identify the clinic or the physicians on Guam who's going to take care of them, because it's a process. Once you start the abortion process, it's not 100% that you're going to abort. You're going to have incomplete abortions, in which case you got to do surgery. So who's going to take care of those? Certainly you have to identify those. So it's not a simple, abortion by mail, you're going to be okay. To me, that's inappropriate. So I think they're going to fight about it. But then again, if the governor is already supporting it, and then they're suing the governor, they're suing the Gov Guam. Come on. It's all conspiracy, in my opinion.
Well, Doc, let me just wade in here, and I don't want to go all the way to conspiracy this early in the morning, but I will say that if they didn't have direct communication with the ACLU and the government channels, maybe it was done outside of the government channels, but also in the communication that Mrs. Flores had sent out to Planned Parenthood and whoever, I think if they didn't say, hey, ACLU, sue us directly, I'm pretty sure the ACLU through Planned Parenthood was able to find out that, we don't have abortions on Guam through their communication with the governor's office. So I don't know. I'm not sure if there was direct communication outside of the Gov Guam channels, but maybe it was, pretty much implied and very easy to figure out through those emails.
Listen,
that, we're vulnerable to a lawsuit.
The ACLU should get their act together, okay? The ACLU should look at what access is to healthcare that we don't have on Guam. We don't have a rheumatologist. We don't have a gynecologic oncologist. We don't have a pediatric cardiologist. Where's the access to those physicians that they're fighting for? Those are physicians that help us save lives. Those are the specialty that Guam needs. These are the priorities that the Governor Liu should be focused on. Not an abortionist, in my opinion. We send people off island, by the hundreds, by the month after month, maybe by thousands every year that goes off island for healthcare. There's a handful of people who does abortions or who wants abortions. They can also fly off island. So access to care is similar to a lack of access that we don't have here. In fact, it's worse. People die of cardiac disease every day. People die of diabetes every day. People die of congenital heart defects for kids every day. We need to focus on more priorities. And, I'm not the governor. If I was the governor, that would be my priority, okay? Let's focus on those specialists that really will help us save lives on Guam.
All right, Dr. Shieh.
Hey, Chris, you got me all excited here.
I know. I think you can stop walking now. Your heart rate's probably already up.
I gotta go shower and then
Yeah.
go head to my surgery.
Hey,
Gotta
good
save
luck.
some lives.
Good
here.
luck. All right, Dr. Shieh. We'll see you.
Take
Thanks
care.
for stopping by. There you go. That's Dr. Tom Shieh. I think, irregardless of how you feel about abortion, which I'm not trying to have an abortion debate this early in the morning, I think it's a very valid point that we need so many specialists on Guam. It's really tragic, really it is. My brother had a stroke years ago. I remember he had a stroke. We went to the hospital. Of course, he got admitted.
And he was very young when that happened.
Very young, yeah. But the point I'm trying to make is we had to wait for this neurologist to come from Hawaii because we didn't have one on island at the time for whatever reason, and so we had to sit around for a few days. And I'm just saying, like Dr. Shieh makes a very valid point that, and again, just me personally, I'm not saying don't try and lure someone here to perform abortions. I get that, that's a prerogative of the administration, given that, they're pro-choice Democrats. I understand that. But you can do that. You can also do the other, right? And people would be happy if they found out that you were writing letters saying, hey, we need a pediatric cardiologist, or, hey, we need someone to come, other types of pediatricians to look at just other specialized areas, right? And I think that's all it is, really, for me. I don't want to get into the abortion thing, but I think that if we're going to make these efforts to try and lure doctors here to perform those elective procedures, then we should also be making those efforts to lure I think, God, I'm tippy-toeing around this, but I think we can also make those efforts to get much more needed specialists here who would have more of an impact and provide more service to a wider array of people. Again, I'm not saying don't try and get the abortion doctor or whatever you want to call it, but also try and get those other specialists.
Like a medical examiner, perhaps?
Yeah, there you go, a medical examiner. Ooh, Jason Solis with the mic drop there.